Hello, Howard Deal here from the General Agency, and today I will be talking to you about usual, reasonable, and customary charges. Usual, reasonable, and customary charges is the amount paid for services in a geographic area based on what other providers with the same training and experience and specialty are charging for the same or similar service. Basically, what that statement means is if a patient goes to see a non-network provider and the non-network provider is charging more than the going rate, the usual, reasonable, and customary charges, the patient is subject to those. That's above and beyond the deductible and coinsurance amount. Now, plans that have non-network benefits are PPO plans and indemnity plans. PPO plans give the patient the option of going in and out of network. If a patient decides to go non-network, reasonable and customary will apply. That applies to both dental and health insurance policies. Indemnity plans, both medical and dental, will pay non-network services, but anything above is the usual, reasonable, and customary charge the patient is responsible for. That's in addition to the deductible and coinsurance. So, avoiding and minimizing usual, reasonable, and customary charges, best thing to do is stay in network. Most important, stay in network to avoid those charges. Next, do your homework, and we'll go over a little bit about that here later on in the slides. Doing your homework. If you have a scheduled surgery, actually we'll do it now. If you have a scheduled surgery and you are going to a network provider, network hospital, it's important that you communicate to your surgeon that you only want to have people that are in your network assisting him, like an assistant surgeon, the radiologist, anesthesiologist, and pathologist. Those folks you actually want to have in network, and you might want to possibly communicate with them and make sure that they're going to be the one that's assisting in your case. If you do have a reasonable and customary charge, you can contact your insurance company for help, because most people feel uncomfortable about contacting their doctor about additional charges that are on their bill. If you call the insurance company or call your broker, they can help with the billing question and see if it is a true, reasonable, and customary charge or just a billing error. You can also contact your provider with the billing questions and ask them if you have any questions on your bill. It's important that you ask them what the bill is for. Now, the network. When you're staying inside the network, everything seems well. However, there are some providers you'll run into inside the network hospital that are non-network providers. So let's say you go in for a surgery and in the network hospital, you're seeing a network provider, but the anesthesiologist is non-network. That is an additional deductible, additional coinsurance, and you're subject to reasonable and customary. Pathologists, radiologists, and assistant surgeons are the same way. If you're going in through an emergency room, sometimes the emergency room doctors are non-network. You don't really have a choice over that. If you run into one of those problems, you need to contact your broker or the insurance company and see if you can work out those charges. Now, claims can be expensive, so before you have a scheduled surgery, contact your broker if you have any questions. If you don't have a broker, you can contact us and we can locate a broker for you. Reasonable and customary charges is one of the most common charges that a patient will run into that are unexpected. So it's very important that you have a broker. If you don't have a broker, like I said, contact us and we can locate one for you in your area. And that's it for today. Thanks for listening.